Assalamualaikum and good morning everyone. Welcome to our Isbar simulation presentation.
Today, we will be demonstrating how nurses can communicate effectively during a critical patient situation using the Isbar format. Isbar is a standardized communication tool widely used in healthcare to ensure accurate, concise, and structured information sharing between healthcare providers.
The Isbar acronym stands for I, identify, S, situation, B, background, A, assessment, R, recommendation.
It provides a consistent framework to deliver important patient information clearly, especially during emergency or handovers. Using Isbar helps to minimize communication error, improve teamwork, and ultimately enhance patient safety.
In this simulation, we will show a scenario where member nurse reports a critical change in a patient's condition to her team leader and in charge nurse using the Isbar structure.
Our patient, which is Mr. Rahman, is a 55 years old male admitted with pneumonia who suddenly experienced shortness of breath and decreased oxygen saturation.
Let's proceed to the demonstration.
Hello. Good morning, Miss Aisha. This is Ainul, the staff nurse in Ward 5B. I'm calling regarding Mr. Rahman, a 55 years old male patient in bed 12. I would like to report a critical change in his condition.
Alright, Miss Ainul, go ahead.
Mr. Rahman was admitted 3 days ago for pneumonia and has been on IV ceftriaxone. Just now, I found him short of breath, tachypneic, with a respiratory rate of 32 breaths per minute, and his oxygen saturation dropped to 85% on 3 liters of oxygen via nasopharynx.
Okay, that's concerning. What about his level of consciousness and vital signs?
Mr. Rahman has a history of hypertension and type 2 diabetes mellitus. Before this episode, his condition was stable, and then oxygen saturation around 96% on the room A. But this sudden drop happened within the last 10 minutes, and he also has a productive cough with greenish sputum.
Alright. Okay, noted.
And then on assessment, his respiratory rate is 32 breaths per minute, pulse rate 110 beats per minute, and then his blood pressure 160 mmHg and temperature at 38.5 Celsius. His chest cells show coarse crackle in both lower lobes. I have elevated the head of the bed and then encouraged him to do the deep breathing. And I already increased the oxygen flow to 5 liters per minute via face mask. However, his saturation remains at 88%. What should we do? I recommended immediate review by the in-charge nurse and possible medical review for further management. We might need to initiate a high flow oxygen or consider to transfer this patient to the high dependency unit, which is HDU. What did you say?
That's a good assessment, Miss Ainul. Okay, let's go together to review the patient and inform the in-charge nurse for escalation.
Okay, alright.
Miss Ainul?
Yes?
Miss Ainul, do you know when to in charge for Mr.
Yes.
Okay, I will tell something about Mr. Rahman, so let's watch this monitor together. Okay, since regarding Mr. Rahman in band 12, so nurse Ainul has observed that he developed a shortness of breath and low oxygen saturation despite oxygen therapy. So may I brief you using Isbar?
Yes, please.
Okay. Mr. Rahman, he 55 years old, male, admitted for pneumonia, and he suddenly became tachypneic with oxygen saturation 85% on 3 liter nasopharynx. So currently, he's on a 5 liter face mask, and blood saturation is still 85%. So he's on IV ceftriaxone for pneumonia and has hypertension and diabetes. So he was stable earlier today, but respiratory rate 32, pulse 110, and BP is 100/60, and his temperature is 38.5 degree, and lung auscultation shows that bilateral cravicles and possible worsening for pneumonia or fluid overload. So I recommend notify the medical officer for urgent review and opting for ABG, and also prepare the emergency trolley in case of deteriorations. We also may need to initiate oxygen via non-rebreather mask.
Yeah, I think both of you do a good job. So please continue to be close monitor and inform me immediately if there is a condition worsen. And I will contact the medical officer now.
Okay guys, so from this simulation, I learned that Isbar is not just a format. It's a mindset. It trains me to think critically, prioritize essential information, and communicate clearly under pressure. In real clinical postings, I sometimes hesitate when reporting to senior staff, but using Isbar gives me confidence and structure. It also ensures that my message is professional and comprehensive, that will covering who I am, what the problem is, the patient context, my findings, and what needs to be done. I realized that even small details like oxygen level trend or recent intervention can change how the case is managed. This practice has improved my clinical judgment and communication confidence.
As a team leader, I found Isbar very helpful in coordinating communication between the member nurse and the in-charge nurse. It helps me validate the information, clarify any missing data, and ensure that we escalate is accurate and complete. In this simulation, I also learned the importance of active listening and verification. Sometimes, in busy wards, we may rush or assume things, but Isbar keeps communication disciplined and structured. I also realized that tone and professionalism matter. Speaking clearly, maintaining calmness, and showing respect when escalating concerns build trust within the team. This skill will definitely help me when I transition into leadership roles after graduation.
From the in-charge perspective, Isbar make a huge difference on how quickly I can make decisions. When the team communicates in a structured way, I immediately know the patient identity, the current issues, the relevant background, and what's already has been done without having to ask repeatedly. It reduces time delay and minimizes miscommunication, which is a major causes of patient safety incidents. I also appreciate on how the junior nurses shows teamwork and initiative. This simulation highlights good communication is not only about speaking, but it's also about listening, confirmation, and collaborating. I aim to encourage all team members to practice Isbar consistently, whether during emergency, shift handover, or phones updates. It truly promotes a culture of safety, accountability, and professionalism.
Overall, this simulation reminded us that effective communication is as vital as any clinical skill.
Practicing Isbar helps us speak confidently, think critically, and work as one team.
And most importantly, it ensures that every patient receives safe and timely care.